Hi, I'm Dr. Surindher. I'm the Director of Aesthetics Plus Clinics. We got a question from Rakesh, who is one of our channel subscribers, and he was asking about what about the density after a hair transplant? What is the ideal density and what would be the density that we can achieve after a hair transplant? Now, this is a multiple fold question if you look at it. One is, of course, when you're doing the hair transplant is whether you have gone fully bald or you still have thinning of hair, and that is when you're doing it. Second thing is the donor area. How big is your donor area? That is your second problem. Now, this is basically a question of demand and supply. Your supply is limited. The safe zone in between your ears at the back of your head, that is your safe zone from where we can take the hairs, and that is the hair which will stay on longer and not shed over the next few years. So that is our limited donor area or limited donor supply. Now the second is the demand. The demand will be your actual size of the recipient area or your bald area. If the bald area is too big and your donor site is small, then obviously it's just by simple mathematics if you can see that your hair density is not going to be as good. But if your recipient area is small and you have a big donor area, then yes, you can take a more number of grafts and you can pack the grafts in closer. Now what do we do? Typically when we take, if you have a good donor area, you might get anywhere between 2500 to 3000 grafts. So that you can pack. So if you have 3000 grafts in one sitting, and if you have to pack it in maybe a 4 by 6 inch area, then the density will be a little more. If you have to pack it in a 10 into 6 inch area, then the density is going to be sparser. Or the second option is to pack the front first and then you do the second sitting and then do the remaining area. Another problem is what kind of hair do you have. If your hair is too frizzy and too thin, then again though the number of grafts are less, then the density doesn't show up as much. Another problem is whether you have singles, doubles, or 3 hairs or 4 hairs. 2s and 3s are common if you have a good head full of hair. So when you're doing the FUE, you try and take or cherry pick. We call that cherry picking, where we pick out the 2s and the 3s, so that even if you're putting about 2000 grafts, you're getting about 4000 hairs or 5000 hairs in that area. So that gives you more density. But if sadly you're one of those who has a lot of singles, then if you're putting 2000 grafts, you get only 2000 hairs. So that again shows up that the density is less. So as I said, the density after a hair transplant is based on a number of factors, and yes, you cannot predict everything, and you cannot just say that okay, you're going to get a good density. You have to sit and talk with your surgeon, who will examine your scalp. He will see what kind of hairs you have and what is the donor area, and based off of that we can tell you what is the density. Another point in density is the physically how close you can put the grafts in. It will never get to the level of your normal density of your normal hair that you have, because for that in 1 square centimeter you have anywhere between 100 to 120 hair follicles, whereas you cannot put 120 holes into that 1 square centimeter area just by physical point of making a hole and putting the graft in. So the density that we usually aim for is anywhere between 35 to 40 is a very good density it will give, and it will give you an illusion of a full head of hair. Yes, we are not trying to attain the normal density, we are trying to make it as dense so that it looks that you still have a head full of hair. That is our aim when you are doing a hair transplant. It is not to achieve the normal density which is already there.